Okay, I think we are now recording. Welcome, everybody. This is group number four's presentation here for lesson five. So I will just go ahead and hand it all over to them, and good luck to you guys.
Thank you.
Slide, sorry. The next slide. Okay, so we are going to talk about the Joint Commission, and in this presentation we will define what that is, we'll describe why it was created, and then we will also discuss the various reasons why accreditation is important, and what being accredited means, and why a healthcare facility will seek to be accredited by the Joint Commission instead of one of its competitors. Slide. Accreditation means when a healthcare facility is accredited, it means that an outside or an external organization that is independent of the healthcare facility has performed a review of the facility. The outside organization will determine whether or not the facility is following nationally accepted standards for what qualifies as safe and quality healthcare. If they are, then the facility is accredited by that independent organization, such as the Joint Commission. Next. It was founded in 1951 by the American College of Physicians, the American Medical Association, the Canadian Medical Association, and the American College of Surgeons. It was founded to form an organization that would offer accreditation for any healthcare facility that wanted it. At that point in time, it was voluntary and not mandated by any state or federal law. It wasn't until 1965, when the Social Security Amendment was passed, that there was any requirement for an accreditation. When that amendment was passed, all facilities that have an accreditation by the Joint Commission were qualified to participate in programs that the amendment set up, Medicaid and Medicare. Being accredited is still voluntary, but like it said in that amendment, if you wanted to participate in the Medicaid and Medicare programs, you had to have some kind of accreditation for your facility. Next slide. What is the significance of the word joint? Joint, the definition of that word is shared, held, or made by two or more people, parties, or organizations together. The word joint is significant because there were 4 medical organizations that wanted to create an outside organization that would evaluate the different facilities. They set up that organization so that all 4 of them would be able to have their facilities inspected on a volunteer basis and accredited by an unbiased party. Joint simply means that they teamed up and worked together to create this organization. Next.
What kinds of organizations are eligible for Joint Commission accreditation? Hospitals, general, children's, psychiatric, rehabilitation, and critical access hospitals, home care, including medical equipment, pharmacy, and hospice services, nursing care centers, including nursing homes and rehabilitation centers, behavioral health care and additional services, ambulatory care, including group practices and office-based surgical practices, and laboratory, independent or freestanding clinical laboratories. Next.
Who are its competitors and how do they differ from their competitors? I was amazed when I started doing some research on this, just how many competitors there are to the Joint Commission, because I had always experienced Joint Commission surveys and had never even known there were competitors. But there are several competitors for healthcare accreditation, and they vary in the size of the organization, the quality of the survey that they do, the cost to healthcare institutions, and especially in their intent. And what I mean by that is some of them specifically survey, for example, durable medical equipment, or some of them specifically survey ambulatory surgery centers. So some of them are very narrow in their scope. There are varying degrees to commitment to assessing medical ethical standards and clinical standards. And there are both national accreditors and international accreditors. Slide. So some of the more common national accreditors are, of course, the Joint Commission, and it's the oldest and largest accreditation organization. It's a nonprofit organization, even though it's quite expensive to have a survey from the Joint Commission, and it accredits 4,168 hospitals and 378 critical access hospitals. There's also the Accreditation Commission for Healthcare, ACHC, and they received their deemed status in 1987, and they serve home health, hospice, and durable medical equipment providers. The Healthcare Quality Association on Accreditation, or the HQAA, and it has deemed status for DME providers. Next slide, please. The Ambulatory Surgery Center Association, ASCA, accredits ambulatory surgery centers. The American Association for Accreditation of Ambulatory Surgery Facilities also accredits ambulatory surgery centers. The International Organization for Standards, the ISO 9000, accredits businesses of all kinds, but it also accredits hospitals. But it focuses more on customer satisfaction and quality management from a business standpoint rather than a clinical focus. So they may go into the organizations that they survey and look at their systems and their patient satisfaction and how they can improve as a business. Next slide, please. The Det Norske Veritas, which means the Norwegian Truth, DNV, is quickly becoming the Joint Commission's most popular competition. It's based in Norway, and it received its deemed status in 2008. Now, the DNV is very popular with the people that it surveys, with the organizations that it surveys, because of their reputation of cooperation and their reputation of trying to really help you instead of being punitive with their surveys. But they also maintain stringent standards at the same time. Another popular feature is their use of the ISO 9001 quality management standards. So far, DNV has accredited about 300 hospitals with another 80 waiting to be accredited. One of the big differences between the Joint Commission and the DNV is that the DNV surveys annually, every year, rather than 18 to 36 months. And the price of a DNV survey is approximately the same as a Joint Commission. The next slide. So also there's the Healthcare Facilities Accreditation Program, HFAP, and it's one of the oldest competitors. It provides accreditation programs for hospitals, clinical laboratories, ambulatory surgical centers, office-based surgery, and critical access hospitals. It also accredits mental health and physical rehab centers and provides certification for primary stroke centers. It received its deemed status in 1965 and accredited about 214 hospitals in the U.S. by the year 2012. Next slide. The compliance team is a for-profit entity. Most of them are nonprofit, but compliance team is for-profit. It was granted deemed status in 2006, and it accredits DME providers. It serves about 5,000 providers in the U.S. and Puerto Rico. The Community Health Accreditation Program, CHAP, it's a nonprofit accreditor that focuses on community-based care providers. It accredits about 9,000 facilities. The Accreditation Association for Ambulatory Healthcare, AAAHC, was founded in 1979, and it provides accreditation for ambulatory healthcare organizations, including ambulatory surgery centers, office-based surgery centers, endoscopy centers, and college student health centers. Also, it accredits health plans such as HMOs and PPOs. It has begun to extend accreditation internationally, beginning with Costa Rica and Peru. Next slide, please.
Sorry, that's me. My little ones keep running in and out. What percentage of all healthcare hospitals are Joint Commission accredited? 77% of all the hospitals in the United States are accredited by the Joint Commission, and that is 88% of all hospitals that are accredited in the United States. Let's see, wait, let me rephrase that. 88% of all hospitals in the United States are accredited, and 77% of those hospitals are accredited by the Joint Commission. Slide.
What is the meaning of the term deemed status? Who gives it? To whom is it given? Deemed status is when a healthcare organization complies to the condition of participation and condition of coverage, which are explained by the federal regulations. When you have deemed status, you are allowed to participate and receive payment for the Medicare and Medicaid programs. The Joint Commission is the main organization that gives deemed status. It is given to ambulatory surgical centers, clinical laboratories, critical access hospitals, home health agencies, hospice agencies, hospitals, and psychiatric hospitals. Slide.
Brother Gage, I'm not sure how you would like to watch the link for that.
Well, let's figure it out here. Can you hear that?
Yes.
Okay. You want me to just push play?
Yes. I don't think the sound worked on the recording, so whoever's watching this, if you want to go rewatch that YouTube clip, it's pretty funny. It just basically describes some of the tension that comes when the joint inspectors are coming to inspect the facility, and Carolyn is going to talk a little bit more about how that it's funny, but it actually does feel very much like someone's coming and they're watching all the time. So, slide.
This question is explain the process and frequency of Joint Commission surveys. So the initial surveys for organizations undergoing their very first Joint Commission survey, and the first survey conducted under the early survey policy requests are unannounced surveys, announced surveys, excuse me, unless the organization requests an unannounced survey. So the very first time they get to have an announced survey. For the most part, though, Joint Commission surveys are unannounced, nice surprise, and usually conducted between 18 and 36 months after a facility's previous full survey, unless it isn't logical or reasonable to do so. Some exceptions are, for example, the Department of Defense and the Bureau of Prisons facilities. In addition, some organizations receive a 7-day notice because of their size, their caseload, or surveyors needing advanced security clearance. Laboratories have their surveys every 24 months and prior to the expiration of their accreditation. Next slide. The survey process is aimed, believe it or not, it's as stressful as it is, it's really aimed at improving the facility's performance and patient outcomes, and it's tailored to the specific facility. The survey typically begins with a survey planning session and then an opening conference with an orientation to the healthcare facility. So the healthcare facility will sit down with Joint Commission and give them an orientation to their facility and what it does. The survey process for Joint Commission uses a tracer method to assess standards compliance. So a single patient may be traced through his or her experience at the facility, going step by step through the documentation of their care. Also, a tracer may be done on different systems within the facility to determine how well they integrate and communicate. An example of this would be, does the patient's medication record follow through from the emergency department to the radiology department and then on to the operating room and then on to the nursing floor to make sure there's a continuity of care. Other issues the survey addresses are to ensure that the staff are appropriately credentialed. An assessment may be made on the competency of the staff and the environment of care session to determine if it is a safe facility, and that often includes a tour of the building. The on-site survey concludes with an exit conference where the survey team presents the facility with a written report of their findings. The survey process, Joint Commission can request certain documentation. This is a really important thing for people that are going to be hospital administrators to understand a Joint Commission survey, because the administration is on the front line of this, because they're the ones that sit down with Joint Commission at the start of any survey process, and they're face-to-face. It's a little bit of a joke around the hospital that people will try to hide from the from the surveyors, but the administrators cannot hide. In the operating room, we always expected to not have to face them because they couldn't come into our rooms when we had patient care, so we would all either try to take the day off or stay in the operating room. So an administrator is on the front line of that. And I was telling these other students earlier today that sometimes a hospital will ask for a specific focus from the Joint Commission on their survey to see if there's some way that they can improve their process. And one example of this is the VA hospital where I work. The VA has taken a lot of criticism from their patients for not seeing them in a timely manner. So the VA has requested a focus survey, and the point is to help Joint Commission to help them improve their process. So today I found a little document list of what the Joint Commission requested the VA, the documents that they requested the VA to provide for them during their surveys. And some of them were patient flow wait times, readmission rates, veteran satisfaction rates, employee satisfaction, staff turnover rates, medication error reports, patient events, incidents, or unusual occurrence reports, infection control summary reports, infection control plan, hand hygiene program. So you can see that the Joint Commission can request quite a few documents, and the process to prepare for them is pretty extensive. The Joint Commission can come up to employees during their survey and request information from them. The best thing to do if that happens to you is not get too worried about it. They're not mean, but the best thing you can do is know where to find all of the information that they might request. For instance, they might request your material safety data sheets, which are sheets that explain your chemicals that are used in your job and what harm that can cause you. If you know where to find those, you don't necessarily have to show them to them. You just have to be able to tell them where to find them. So you don't have to worry about Joint Commission, although they may talk to you, and they may talk to your patients also. So preparation is important for a survey. Next slide.
Why would a hospital choose to be accredited by an organization other than the Joint Commission? There are 3 different organizations to choose from. The first and oldest organization is the Joint Commission. Secondly, there is a healthcare facility accreditation program. It was founded over 30 years ago and has over 220 cases. Thirdly, there is the DNV, which is the newest. The organization has 27 hospitals in 22 states participating in its accreditation program. It is working to build its reputation and gain support from insurers. The only reason people would go to other choices rather than a Joint Commission is because they are faster and easier to join. The Joint Commission has more rules than the other organizations. Also, because of the Joint Commission's popularity, they can be more selective with their choices. Next slide. Conclusion. Being accredited is a complicated process that every hospital must go through to be nationally recognized. The facilities must go through many different steps to ensure quality care is being provided. The Joint Commission is constantly changing the rules and regulations to ensure that the facilities are providing the best and newest ways to give care. The Joint Commission creates safe working environments and the best patient care possible. Next slide. And then those are
This is a list of all of our sources. We compiled all of our sources where we got all of our information. So if you wanted to read up more on the history of the Joint Commission or, you know, some different reasons why you would want to pick the Joint Commission, you can just follow our sources.
All right. Is that it for you then?
Yes.
Ready for a couple questions?
Yes.
So I was curious, in your research and everything, what happens if a hospital doesn't pass a visit from the Joint Commission?
Can I address that? That does happen. That does happen. But generally, what happens is when they do their little post-conference, they will talk about issues that they found with your hospital. Okay, so they may have found outdated medications. They may have found that a patient slipped through the cracks on their tracer. They give you a certain period of time to fix the problem.
And if that's not fixed?
Oh, that's a tough question, Brother Gage. If it's not fixed, I would presume you could lose your accreditation.
Okay. Yeah, no, that's true. You can have a probationary period where you can temporarily lose your accreditation. There's fines that can be involved as well, just so you know. Okay. One of you had mentioned, let's see, I think it was Amanda or Christina, I can't remember exactly, had mentioned about how, as far as accreditation goes, about 88% of hospitals are accredited, and of those, something like 76% are accredited by Joint Commissions. Does that sound about right?
Yes.
So that 22% of not accredited hospitals, why aren't they accredited, and what does that mean for people who visit those hospitals?
Well, if they aren't accredited, again, accreditation is a completely voluntary process. Having the stamp of accreditation simply means that someone who is unbiased has walked through the facility and said, these are some things that you are not doing that you need to do. You know, when you get accredited, you get basically the rubber stamp of approval is the best way I can think to describe it. If they choose not to be accredited, when you as a patient are going to the facility and you see that they're not accredited, you should be more aware that there's the possibility that you will get substandard health care. And if you're on Medicaid and Medicare, your health care services will not be covered by your insurance. So, yeah, that's what I found.
That's good. And Christina, would you go to a hospital that's not accredited?
No.
If you were to go to a hospital, would you look up first to ensure that they are accredited?
Yes. Well, my mom is actually a nurse, so it's always just been kind of like we go to the hospital she works at, so I've never had a situation where I could choose, but now after doing this project, yes, I would make sure they're accredited.
Would you make sure they're accredited by Joint Commission, or would you be okay if they're accredited by another body?
Probably Joint Commission, just because it's the biggest and the most known one, so that seems like the best idea.
Okay.
Personally, I'd be okay with either. I was raised in Rexburg, and Madison Memorial Hospital is not accredited by the Joint Commission, and that's where both my children were born, and the healthcare there is great. So just a plug for not a Joint Commission. I'm okay with either. I would definitely have to say I would look for one that is accredited, though. 9-year-old, he's mad he can't come in.
Okay, and I guess one little tie-in question, I think it's a pretty kind of good topic that we've gone over with this accreditation versus not. You know, we're all here at BYU, Idaho. Would you go to a school, a college that is not accredited within the specific bodies?
I wouldn't. My dad is a professor on campus, and I know that when BYU Rick switched to being BYU, the mechanical engineering department did have to go through some different accreditation processes, and they had to change around their curriculum. Just from that experience, I know that if you don't get an education that is accredited, it is almost worthless, because if you don't have a degree from a college that is reputable enough to say, hey, I went to this college, I got this degree, then people who hire you are not necessarily going to know that your education covered everything that you needed to learn, and so they will be less likely to hire you, especially in a healthcare position, because there are a lot of responsibilities that come with what we are wanting to do, and personal mistakes we can make. There are all kinds of longer lasting results of mistakes that could bring a complete education. So BYU Idaho is accredited as far as their programs are accepted and nationally accepted as good programs to finish so that you are qualified. So I would say yes, I would always want to make sure that I have an education in an accredited school. I hope that's what you are looking for.
Also, if you go to a vocational program or like a nursing program or something, your certification and your licensing is affected by whether the program is accredited or not. So there's no sense going to a school that isn't accredited if you're going to get a certification or a license of some kind.
Okay, very good. So in your minds then, accreditation is weighed a little heavier within a higher education college setting than in a hospital setting. You would go to a hospital not accredited, but you wouldn't want to go to a school that is not. Is that correct?
No, I'd only go to both if they're accredited.
Yeah.
I think what Amanda was saying was that the hospital she was talking about wasn't accredited by Joint Commission, but it was accredited by another body. Is that what you meant, Amanda?
Yeah, it was the 9001 9000.
Oh, the ISO.
Yeah,
the ISO.
Madison Memorial Hospital is accredited by ISO. So it's not accredited by Joint Commission, but it is still accredited.
Gotcha. Great. I think that's all the questions I have. Would any of you want to add anything before we let you all go?
Could I tell a little story about Joint Commission?
Of course.
Visit. I worked in a little bitty hospital in town, and we knew when the surveyors were coming because there was a VA hospital in town which their surveyors had to have a background check. So we heard all day long, the surveyors are coming today, the surveyors are coming today, so we were waiting for them. One nurse had gotten really frustrated with her little old man patient, and he kept hopping out of bed and he kept wandering off, and she couldn't keep track of this little old gentleman. So, and I don't agree with this, but she took his clothes away from him. And so he, true to form, decided to get up and wander, and he wandered totally naked to the outside of the hospital and was sitting on a bench outside the emergency room when a Joint Commission decided to come up to the hospital, and they came upon a totally naked patient sitting outside the emergency room, and it wasn't funny at the moment, but later we were kind of amused by that. It was just you have to have been there to see how funny that was. But
I think we can all understand some Joint Commission horror stories to one degree or another. So thank you for sharing that.
Yeah.
Anything else? Okay, well, very good job. I appreciate you putting the time and effort into it, and I'm sure it's going to be very beneficial for the other students as well. So be looking for that to be posted, as it will be in the lesson 5 when we get there. So very good job. Thank you again.
Thank you.
Thank you.
Okay, have a great rest of the evening.
You too.
Bye.
Bye.